manifestation we saw in ulcerative colitis. We see intestinal manifestations like painless bleeding, PR, streaks of blood in stools, and large bowel diarrhea. In case of Crohn's disease, we saw malabsorption, fever, weight loss, systemic symptoms, and episodic right lower quadrant pain, which is the most common presenting symptom. And also extraintestinal manifestations, we saw ankylosing spondylitis, sacroiliitis, uveitis, scleritis, systemic amyloidosis, erythema nodosum, pyoderma gangrenosum, and osteoporosis. The investigations findings common to both. We saw blood investigations and serology. The specific investigations, we saw two markers, calprotectin and lactoferrin, seen in ulcerative colitis on endoscopy. Endoscopy and biopsy are the gold standard investigations done in ulcerative colitis and Crohn's disease. The radiological features, we see toxic megacolon on Barian enema. We can see collar button appearance and blood appearance in ulcerative colitis. And endoscopic and microscopic findings similar to pathological findings, which you have already mentioned. We can see serpiginous findings, serpiginous ulcer strictures, fistula. On biopsy, we see non-caseating granuloma. On radiological examination in Crohn's disease, we see on Barian lemma, after ulcer, fistula, tract, cobblestoning, and sting sign of Cantor. The treatment we saw in ulcerative colitis, we classify true love and BITS classification, mild, moderate, and severe disease. In mild disease, we give mesalamine followed by topical 5-ASA maintenance. In moderate disease, we give oral mesalamine and steroid followed by azathioprine and 6 mercaptopurine if it is resistant to this. The maintenance, we give topical 5-ASA and azathioprine or 6 mercaptopurine. In severe disease, we give IV steroid with anti-TNF alpha agents or IV cyclosporine followed by azathioprine, 6 mercaptopurine, and IV TNF alpha or oral cyclosporine maintenance. In Crohn's disease, we classify as mild to moderate disease, moderate to severe disease, and severe to very severe disease. Mild to moderate disease, only oral budesonide 9 mg per day is enough. In moderate to severe disease, we give oral steroid methotrexate with anti-TNF alpha agents, and maintenance we give 6 mercaptopurine or azathioprine with methotrexate and periodic anti-TNF alpha agents. In severe to very severe disease, we give IV steroids and IV TNF anti-TNF alpha agents. For maintenance, we give periodic anti-TNF alpha agent. This is about inflammatory bowel disease. Thank you for listening.